Paget's disease of nipple is the superficial manifestation of underlying breast cancer. So, two words are very important in the definition of Paget's disease of nipple. One is there is a superficial manifestation of the disease, and second, there is underlying breast disease or underlying breast cancer. What is the superficial manifestation? How patient will present to us? The most common presentation of the Paget disease is eczema. There will be itching, redness, dryness of the nipple and areola. And second, the underlying disease will be most commonly invasive ductal carcinoma. This is the most common, and there can be ductal carcinoma in situ also. So, this is the clinical manifestation of the disease, where you can see the skin of the nipple and areola region is red, dry, eczematous. So, remember the clinical presentation of eczema of nipple and the areola region, and this is not responding to the treatment. Finally, biopsy is done, and what we see in the underlying biopsy is shown here, which is the DCIS with Paget cell. So, let us understand how to interpret this biopsy. This is a picture showing Paget's disease, nipple region. This is a foci which is showing crust and eczematous area. Focus of the underlying disease, which is invasive ductal carcinoma. So, this particular lesion where large polygonal cells are present, this is DCIS or invasive ductal carcinoma. Now, these malignant cells, they come along the lactiferous duct, nipple, and then they invade the skin and produce eczema like situation. Friends, let us make the notes of all the most important points which can be asked from Paget's disease. For example, most common presentation of this disease is eczema, and particularly eczema of the nipple and the areola region. Second, the most common underlying disease or most common underlying cancer in the case of Paget disease will be, this is very frequently asked question, and answer will be invasive ductal carcinoma followed by ductal carcinoma in situ. So, if you have option of invasive ductal, put that, otherwise you can go for DCIS. And remember, what is never seen in the case of Paget's disease is LCIS, lobular carcinoma in situ, is never seen in the case of Paget's disease. Investigation of choice in the case of Paget's disease is biopsy, or you can call it histopathological examination, biopsy or the HPE. The type of biopsy done here is either wedge biopsy or the punch biopsy. Okay. For the breast mass, we usually use true cut biopsy. Here we are using wedge biopsy or the punch biopsy. What is not done to investigate a case of Paget's disease is the cytological examination or FNSE. FNSE or cytology is not done in PD cases. When you examine Paget's disease in HPE, this can be asked as a theory, or as for image based question, what are the types of cell you see in Paget's disease? First of all, you call them Paget cell, and they are large polygonal cells. Paget cells are large polygonal cells. They are filled with glycogen. And due to glycogen, they often appear clear or pale. Their cytoplasm will appear clear or pale, but because of the glycogen, they will be PAS positive, and this particular glycogen is also mucicarmine positive. So, large polygonal cell with PAS and mucicarmine positivity is suspicious for the Paget's disease. Nuclear features are also very important. I am drawing a Paget cell, which is a large polygonal cell. This is a nucleus, which is a rounded nucleus. Very important, rounded centrally placed nucleus with small dots inside the nucleus, and we call it prominent nucleolus. Round and large cell, first point. Round nucleus, second point. Prominent nucleolus, third point. And cytoplasm will be pale, which will be filled with glycogen, Pass positivity and mucicarmine positivity. Histopathological slide, image base, very important. Friends, can you appreciate these large cells? And these are the rounded nucleus. The small dots, these are the large cell rounded nucleus and small dots inside the nucleus. Yes, this is nucleolus. So note, large cell, rounded nucleus, prominent nucleolus, and these cells are glycogen positive. ISC can be asked of the Paget's disease. In fact, it has been asked previously. CR positivity, S100 positivity, then recent update Milan A positivity, and also EMA positivity. CR, S100, Milan, and EMA positivity is seen in the case of PD or Paget's disease. Special stains again asked in the examination. Pass and mucicarmine are two most frequently asked special stain in Paget's disease. Pass and mucicarmine positivity is seen here. And last but not the least, treatment of choice of PD, simple mastectomy. Simple mastectomy will be done whenever you see a patient with eczema and the underlying DCIS or invasive ductal carcinoma is found. You have to go for simple mastectomy. Many a times you won't find underlying mass. So remember, underlying mass is not mandatory for the diagnosis of PD, but if you find underlying mass, then this is again very important point. If you find underlying mass, this particular situation increases risk of underlying malignancy. So if you don't have mass, you cannot rule out PD, but if you have breast mass, it means there are increased risk of malignancy in these cases. So let's revise all the important points of Paget's disease. First, eczema is the most common presentation. Image base of Paget's disease showing eczema of the nipple and areola. Most common breast disease underlying it is invasive ductal carcinoma. Diagrammatic representation of the Paget's disease. Underlying lesion which has large polygonal cells. Most common presentation, most underlying disease, and what is never seen in PD. 3 important MCQs. HPE finding, what is the IOC, what is not done, how the Paget cells look like. Image base of Paget's disease. ISC, special stain, treatment of choice, and a point to remember, mass increases risk of malignancy.